the opposition, other groups as well, suggesting this reopening plan might not be the best of ideas. What do you say to those people, and maybe people as well who might not feel like we're at an appropriate time to get rid of the REP and start removing restrictions?
Look, most Albertans want us to start getting life back to normal. And this plan is about doing that safely and cautiously. We won't lift the vast majority of public health restrictions for at least 3 weeks, and only then if we see a continuing decline in pressure on the hospitals. But Saif, we cannot continue to damage people's lives, to violate their rights and freedoms indefinitely. We've just got to learn to move forward. Now that 90% of the population has first dose vaccination, 87% second dose, Omicron being less severe, our hospitals right now under less pressure than they typically are at this time of year, with all of our case numbers, total active cases, wastewater data, new hospital admissions, all coming down. We think this is the right time to move forward. The thing we've prioritized here is kids. Kids have paid too much of a price in the past 2 years, and I think it's very disturbing that the teachers union is threatening to sue the government to force kids to wear masks in school indefinitely.
Right. Now, some people might point out last year your government sort of had the same level of confidence when it came to reopening for summer, and that didn't work out as well as I think anyone had hoped. How is this going to play out differently this time around?
Well, first of all, we were at 78%, actually only 68% second dose coverage, and now we're up to 87% second dose coverage for vaccination. That's a huge difference. Secondly, Delta was a much more severe version of COVID. Omicron is much less severe. And thirdly, I think, Saif, if you watch what's happening around the world, there's a growing consensus that we need to move forward and try to get life back to normal. Yes, cautiously and step by step. But even Dr. Tam in Ottawa said this week that we need to do this, and provinces should be re-examining policies like proof of vaccination programs. Countries like Finland, Sweden, Denmark, Norway, England, Ireland, South Africa, states like New York, California, provinces like Quebec and Saskatchewan have all announced plans to go in this direction. I believe that it's safe and prudent. Now, if we see things go in the wrong direction, we will pause the plan always to protect our healthcare system and make sure there's a bed there for everyone who needs one.
Right. Now, there are some suggesting your reopening plan coming out just ahead of your leadership reviews. No coincidence, maybe it's you trying to reestablish some of that support that you had lost with people over the last 2 years when you did put restrictions in place. Is there any truth to that?
No, Saif, this is not about politics. This is about getting life back to normal for everyone. And you know, it's no secret that our government has been reluctant to bring in damaging restrictions and eager to lift them as soon as we can, because we understand the damaging effect that this, after 2 long years, 2 years of this, the damaging effect it's had on mental health, people's emotional well-being, their financial well-being, particularly for kids and adolescents. And listen, I've mentioned countries, states, and provinces around the world that are moving in the same direction as Alberta. They're not doing that because of any local political considerations. They're doing it because they've determined it's the right thing to do.
Now, was there any reluctance in your cabinet meetings, or maybe from the chief medical officer of health, when you guys were deliberating whether or not to go forward with this plan?
No, to the contrary. On December 28th, our COVID cabinet committee came to a unanimous view that the proof of vaccination or restriction exemption program was really no longer serving a useful purpose, that we're kind of frozen in terms of our demand for vaccinations, and that with the transmissibility of the Omicron variant and the diminishing protectiveness of the vaccines against infection and transmission, that proof of vaccination program really no longer is justifiable. And so that we decided in December to lift that as soon as we could. There's always a debate around the table about exactly, which measures to proceed with. And we always look at this as having a risk budget, and that we can't do everything that we would like to do in terms of lifting public health measures right away. We have to do it in a phased way, a gradual way, a way that keeps an eye on total hospital capacity. But we came to a strong consensus on that.